under a Section 1115 waiver. So what does that mean? What that means is that there's some key themes that are emerging, and again, I'm not going into the weeds of waivers, but so what these states are doing is, number one, they're charging some premiums and they're charging some co-pays. Now, traditional or Medicaid expansion, as written into the law, there's no premiums, there's no co-pays. But in these waiver programs, they are charging premiums and co-pays. There's a popularity of premiums, especially for people over 100% of poverty. But two states, Indiana and Montana, have premiums even for people under 100% of poverty. Now, the waiver program does not allow the states to disenroll people under 100% of poverty for non-payment of premiums. But it can be a barrier to people if they think they have to pay premiums and they don't understand that. The federal waiver program also has said that you can't terminate, you can't have work-related requirements either. So, but the states really keep pushing. They encourage work or job training. They make it available to folks. Some states have requirements that promote healthy behaviors or personal responsibility. And the states really are pushing these work requirements. Some states are pushing time limits. They want to limit the amount of time you can be on Medicaid. They're pushing enforceable premiums below the poverty line. And asset tests. We haven't seen those yet, but the states are trying to do that. So kind of as we see some of our southern states maybe move a little bit closer to Medicaid expansion, we're also going to see applications for these 1115 waivers so that they can say it's not Obamacare and that they can kind of impose their own requirements on there. So there are several states now that are considering pursuing a waiver or changing a waiver, changing their current waiver to make it even stricter. And you can see the states there. So let me just give you a quick overview of the South, where the Deep South states are on Medicaid expansion, and then let's have some time for conversation. So there are two southern states that made a real concerted effort in 2015 to expand their Medicaid and actually made some progress. One of those states is Florida. Remember, Florida has, what did I say, 20% of the people in the coverage gap. And then the other state was Tennessee. So let's look at Florida. Governor Rick Scott basically flip-flopped back and forth on Medicaid expansion. For a while he was supporting it, and then he changed his mind and decided he wasn't supporting it, and by the time it was introduced in the legislature in June of 2015, he was firmly opposed to Medicaid expansion. The Republican-controlled House of Representatives soundly rejected expansion in Florida. All 37 Democrats voted to expand, and 4 Republicans actually voted to expand. And interestingly, in Florida, the Senate voted to expand Medicaid. 33-3 vote. So there's a real split in the legislature in Florida. So that's progress. We've got one house going for Medicaid expansion. Florida has more than 500,000 people in the coverage gap. So Florida really needs to expand. They have an advocacy coalition in Florida called Florida Chain, which really actively worked for Medicaid expansion there. And the media got really involved in Florida. And I would say that this is an advocacy strategy to think about. So this was the front page of the special editorial section of the Tampa Bay Times. And the Tampa Bay Times identified all the leadership of the legislature exposed to expansion and put in their contact information so people could let their wishes be known.
Yes.
So that was nice. And then the Miami Herald on April 17th, 2015, when this was all being considered, published the stories. There's Amanda and Carolyn's kind of suggestion here. They published the story of 12 people who fall in the coverage gap in Florida. So as a way to engage legislators. So I think engaging the media is important. They didn't get it in Florida yet, but they'll keep trying. They have a really strong coalition there. There were also efforts in Tennessee. Tennessee had one of these, they would have had to apply for a waiver. They had what they call a market-based plan. And it was only for those with incomes between 100 and 138% of poverty. So it would not have covered people below 100% of poverty. So it didn't really address the whole coverage gap. There were two parts to the Tennessee plan. There was a part where they would have given vouchers to people with employment-based plans so that they could purchase insurance rather than just having the government provide the Medicaid. They would allow people to purchase insurance, but they'd have to, and they had vouchers to help pay for premiums. For people who didn't have employer-based insurance, they would have had something similar to private insurance, and they would have had premiums and had to pay out-of-pocket expenses. In Tennessee, there was really strong support from the Tennessee Hospital Association and from the business community and the Tennessee Medical Association. And I would say that my personal opinion, just kind of looking at the landscape in the South and nationally, is that if we can get the strong support from our hospital associations and from the business community on this Medicaid expansion in our coalitions, that we're going to go a lot further. I mean, there are hospitals closing because they are having to pay for uncompensated care for people showing up in their emergency room. So the hospital associations are kind of really logical allies of ours. In North Carolina, the Hospital Association does support Medicaid expansion, but they have not taken the kind of active role that we would hope that they would take. There was also in Tennessee a strong coalition led by the Tennessee Justice Center, and the governor was strongly in favor of Medicaid expansion in Tennessee. He called a special legislative session, where expansion was considered and went down in committee, and then in the regular session, the plan was again defeated in committee. So the advocates in Tennessee are, I would say, pretty deflated right now. I don't know if we have any Tennessee advocates in the audience, but I don't think they're giving up. They still have the governor on their side, so that's helpful. And then the media did get involved in Tennessee too. There's a senator in Tennessee, Todd Gardenhire, who in the halls of the state capitol called a supporter of Insure Tennessee an a-hole. So that's the reference here. We are not that vulgar term you called us, Senator. This was an editorial in the main paper in Tennessee, the Tennessean, in favor of Insure Tennessee, their expansion plan. And in reaction to this senator who used that term to describe a supporter. And again, the leadership that voted against Insure Tennessee is pictured here with contact information. So I think getting our media allies on our side on this issue can be a strategy. Now, I hate to talk about Alabama with the Alabama folks sitting in the room, so you tell me if I say anything wrong. But I think there's hope in Alabama. Yes. So in Alabama, the governor, who is a physician, Governor Bentley, organized something called the Health Task Force in late 2015. He had 30 members with broad representation across the healthcare field, including a CEO of one of the AIDS service organizations, AIDS medical clinics, HIV/AIDS medical clinics in Alabama, Michael Murphy, was on that task force. The task force has recommended that the governor and the legislature find a way to provide health insurance to Alabamians without coverage. Now, it didn't come out and say it supported expansion, but that sounds like expansion to me. I don't think the full report is out yet, right?
Correct. It's being released in the next couple weeks.
Yeah, so the full report from this task force is expected to come out in the next couple of weeks. And I think we're hopeful that it will have language that would really further the issue of Medicaid expansion in Alabama. If we could get Alabama, man, that would really be helpful in advocacy in North Carolina and other states. So and there's a strong coalition there called Alabama's Best. There's some folks here from AIDS Alabama who are members of that coalition and who are doing the work. So hope in Alabama. So I'm starting with the good news. Not much hope in North Carolina this year, okay? Governor McCrory says he opposes expansion unless he can secure a waiver for what he calls, listen for it, North Carolina plan, a North Carolina plan, not a Washington plan. So just think waiver, where they're gonna, if we ever get there. Our legislative leadership remains really opposed to expansion. We are in the process in North Carolina of privatizing our traditional Medicaid program and to make it a managed care program, and the DHHS, the Secretary of Health and Human Services, has just written the proposed waiver that will have to be given, submitted to the federal government to privatize our Medicaid. We had hoped that Medicaid expansion would be part of that waiver. It wasn't, but the legislature still has to vote on it, so we'll see. There is a coalition being led by the Justice Center and Planned Parenthood advocating for Medicaid expansion. Our Moral Monday movement in North Carolina has really held up the Medicaid expansion issue and marched on the legislature and has included it in their big rally that they have every year in Raleigh. But advocates don't really see much hope this year, although we keep pushing. And we're hoping that the federal government, when they see this waiver request for the traditional Medicaid program, will say, wait a minute, you want us to grant this and you haven't expanded your Medicaid program, and maybe kick it back. So there'll be some advocacy happening on the federal level when that waiver request goes up. And then Georgia, Mississippi, South Carolina, and Texas each have strong opposition from both their governors and their legislatures. They all have coalitions working to expand Medicaid that include the hospital and medical associations and business community representatives, but the advocates I talk to don't hold out a lot of hope. Texas has 750,000 people in their coverage gap. And I'm just gonna end so we have time to talk. These are the websites of the coalitions in the 9 states that we looked at, if you're from one of those states and want to get involved. So, that's what we have to present. Now, do we have folks in the room who are working on Medicaid expansion in your state? And if so, raise your hand. I see Alabama, this is North Carolina. Anybody else? Do you all have any strategies from Alabama that you might want to share with us, or what are you thinking, or in terms of the steps going forward?
You've covered a lot of it. So we just had a
Maybe
waiver.
you could stand up.
Sure. My name's Alex Smith. I'm the Director of Policy for AIDS Alabama. They covered a lot of it, actually. We actually had a waiver just approved, not for Medicaid expansion, but to change our Medicaid to a managed care or a regional care organization. It's not exactly privatized, but the state still has a hand in it, and it's a big mess, and we thought that expansion would be part of that waiver, and of course it wasn't. With that report that's about to come out from the Healthcare Task Force, they're calling it Medicaid reform instead of Medicaid expansion, so it's more palatable terminology for our Republican-controlled legislature. So we hope that this report that's coming from the task force will be a catalyst for change for Medicaid expansion. However, we're having issues funding our Medicaid program, even though this waiver was granted. We face about an $85 million shortfall to actually pay for this change to regional care organizations. So the budget is being worked on right now in our legislative session, where we're short $85 million, so the governor is likely going to call a special session once this one is over just to tackle Medicaid. And we're going to have a very pointed advocacy effort during that special session to make sure, or to try to make sure, that expansion is part of that conversation, because with that expansion, there are studies that have predicted that our general fund in Alabama would experience between a $500 million and $1 billion surplus every year once we expand Medicaid. So that would solve our budget woes that we have every year with our general fund, and we could stop stealing money from our education trust fund as well. So that's kind of where we are now. So we're in a holding pattern currently to see what is going to happen with how we fund Medicaid, and we're likely looking at a pretty expensive special session of the legislature.
Thank you.
I want to make one point about North Carolina. Let me stand up. The governor can say now that he would support expanding Medicaid, but one of his first acts when he took office was to sign into law a bill that took away his ability to expand Medicaid and handed it to the General Assembly, the legislature. So he can come out and say, oh gosh, I've had this dream, this vision, we have to expand Medicaid. He can't do it, and he knows it. So he gave away that ability on his own.
And that's very similar in Alabama too. The governor could direct our Medicaid czar to say, yes, expand the program, but the legislature still has to approve it and appropriate it for it.
Right, and that's what he did here.
Yeah, same thing in Alabama.
So he can appear moderate now to get reelected, but it's only an appearance.
Well, our governor's term limited, so he has literally nothing to lose by saying expand Medicaid, but the legislature is just not going to appropriate for it.
Some folks think we need to get through this election year.
For
I
what?
know, we always keep, so, you know, the one thing we didn't say is that in the first 3 years of Medicaid expansion, the federal government would have picked up 100, and did for the states that expanded, 100% of the cost. And now we're at the 90% level. They'll still pick up 90%, but you know, we've already lost money by waiting.
And as you said, hospitals are closing, and there's documentation that people have died because those hospitals closed.
Right.
And depending on which numbers you agree with, whether it's 1,500 people who die every year or 2,800 people who die every year, there's up to 7 people dying every single day in North Carolina alone because we haven't expanded Medicaid.
On the topic of the
Can I share an experience that one of my clients is having?
Sure, and then we'll come here.
Yes, I represent him in other matters, and he describes how he obtains medical insurance. He has no income, and he has a chronic, very expensive health condition and can't afford any medical care. He falls in that, right. So what he does is, and I'm not advocating this, I'm just describing what my client is doing. He pretends to be self-employed, and he declares that he makes X amount of income. He doesn't. And pays Social Security. He files a tax return, pays Social Security. Actually, his brothers and sisters are paying the Social Security and whatever premiums he has to pay to get medical care. They're willing to do that. I guess it's fraud, right?
Well, yeah, that's
Okay.
called federal tax fraud. I wouldn't recommend it. I mean, I get why he's
For
doing
him,
it.
there's nothing to lose. It's life or death. So
Right, yeah,
Yeah.
fraud, okay, send me to jail, then at least I'll get health care.
Right.
So he wins either way,
right, I guess.
right? If you,
Fair
life
point.
or death,
Dan, Steve,
that's exactly the same.
Matt up here and then.
yeah, on the topic of the federal government picking up the tab for states to expand, because I know in our state and in a lot of other
Can you all hear Matt back there? I'm gonna make you stand up.
Yep, that's fine.
Sorry, just, I could
Nope.
repeat the question, but I might not do it
That's all right.
justice.
For I know our state and a lot of other states in the South that haven't expanded yet, many of the opponents, their talking point now is, well, we've already missed that 100% coverage cutoff, so it's not going to be worth it for us to expand because we're going to have to pay more than other states. But one thing from an advocacy standpoint on that topic, there is attempts in the current budget for the federal government that President Obama has proposed that would change that cutoff so that it would just be a rolling cutoff. So anytime any state expands, they have the full coverage from the beginning for 3 years, and then it goes down to that drop no matter when they expand it, which would get rid of that argument
What
entirely.
would it take for him to get that change?
That would
Ask
Congress.
So
So
call your congressman.
yes, so federally
and
advocating
congresswomen.
as well, because then
Has
if
to
we
get through
can,
Congress.
because if we can
In an
remove,
election year. Just Congress.
yeah, so getting that change would help on our level in the states, because then they lose a large argument that they would have against expanding.
I'm new to this. I'm from Mississippi. Of course, our governor, we've been on to talk about him. But my question is, if they were offered 90 to 100% funding, federal funding, why would they not expand Medicaid?
Well,
They give the excuse
Racism?
that after the
So
3
they,
years, they'll
I mean,
have
I
to
don't,
pay.
I'm sorry, I don't, that doesn't.
well,
make any
so
sense.
the arguments I've heard, and you all may have heard others, and you all can come up with this, that when I sat in the gallery in North Carolina when they passed that legislation that required the legislature to sign off on this. First of all, it was, we're not gonna sign off on Obamacare, we're not doing anything to support Obamacare, but they also said the federal government we could sign on to this and then the federal government could stop the program and we'd be stuck.
It's a right-wing states' rights.
It's a kind of a states, yeah,
And then you
right-wing
get to this
states'
election year
rights.
and it makes the whole Affordable Health Care Act look really bad and want people to vote people in who are going to get rid of it.
Right, they're really, their goal is to
You know,
get
if you
rid of the
vote for
Affordable
Bernie,
Care
this
Act.
wouldn't be a problem, just vote Bernie. But anyways, yeah, that was a shameless political plug. But why are we not talking about this in mass numbers? Do people not know that
Well,
our
we're
state
trying. That's why
government
we're
could
doing
have done this
Get out
and didn't
there,
do
go
it?
tomorrow Monday if you're in North Carolina, go to your Mississippi legislature. So the Mississippi Center for Justice in Jackson is one of the leaders of the coalition if you go, there's a,
I got a.
yeah, you can go there and tell them you want to get involved and, you know, I think frankly in some of these states, and I feel a little bit in North Carolina, people are so discouraged by the efforts so far. There've been a lot of efforts, but we can't give up on it, and we just can't.
And this is not, you know, it may or may not help, but on the coast where I'm from, we do have free clinics, and further north where they don't, we suggested that they talk with as many local doctors as they can and see how many of them are willing to volunteer time.
Right.
And then get other advocacy groups involved in helping provide materials, medications, things like that. So I'm just wondering if North Carolina y'all don't have any free clinics. any
We
doctors?
do have free clinics,
But
but
when you get the doctors involved, and because they kind of live in a bubble until they see what the need is and how it's not being met, it helps get them involved in the process of, yeah, we really need to get this done.
yeah, I agree that we need hospital associations,
We need
medical
medical professionals
associations. The free clinics are great, but they're not located everywhere, so that's, I think, the issue in Western North
Yeah,
Carolina.
and that's what, you know, we.
And they don't always provide the level of specialty care that people need,
Right.
and that's when you run into problems with having to pay. And long waiting periods.
Yeah, and most of them are only open a couple
I
days.
have a question. Within the various states, I speak from North Carolina, are there any training grounds where you can help us who advocate be able to better assemble a core group of people, say in our various cities, to help expand this? Because I'm familiar with Memorial March on Monday as well, and participate, but in my local community, there's not a lot going on. And so we're talking about a really, a very real election year this is an issue that many voters are not really up to date on in terms of concern. Yes, they're loving the rhetoric and all of this nonsense, but are you listening to the issues? We want to appeal Obamacare. We want to come up with this flat tax. I get all of that, but are you really digging deep in understanding? And so I was wondering if there's a training ground in the various states, mine's being North Carolina, that will bring us into and sit down for 3 or 4 hours and help us equip ourselves properly to help train in our local area to be more advocate, be more of a voice.
Yeah, I think that the best I can suggest is contacting the North Carolina Justice Center and letting them know you want to work on this issue in your community. And there are lots of around the state at different times, and I don't know if you have anything to add to this, Amanda, but there are workshops that do help people kind of figure this out. There's some really good online resources that kind of explain the issue, but they should be able to hook you into some of that. Did you have something to?
No, I think it's a really great idea, though.
Yeah, it is a good idea.
Yeah.
Yes, sir.
Thank you all for what you're doing. And do you have ways that the stories you have are communicated to our legislators on a regular basis or get into our local media? Because they are, like you say, the thing that will hopefully turn somebody's heart.
Yeah, and with the storytelling, the story collection effort that is a part of the expansion group that I was telling you about, they are doing this kind of campaign of like, tell your story, tell me your story. And they have a website where they have it up, and then they are going to send them out. It's kind of an ongoing effort.
Has the actual citizen done much with you?
No, they've covered some events that have been held.
I mean, tell like somebody's
But the stories, no. I think kind of like Carolyn was saying, that media is, I think, in the Asheville area, Buncombe County, I think it's underutilized, but it could be extremely powerful.
And I think storytelling is emerging. As a burgeoning field for advocacy work. My project that I'm working on now is for health equity in the LGBT community. So I'm marketing towards healthcare providers. But I would be really interested in working on more legislative advocacy issues using storytelling, because I think it's such a powerful tool to touch the heart and engage people in that way. I've also used the arts to do environmental causes, and the efficacy is, I think, really significant.
I have a connection to that. Last week I attended the state PFLAG conference, and a gentleman from North Carolina Equality was there, and he said that that's part of what they do, is they connect people with stories. And he was speaking specifically to parents of gay, lesbian, and transgender children who could go to legislators and tell their stories about what it's like to be a parent. But North Carolina Equality covers a lot of ground, so you might be able to go online and contact them and ask them about that. And I don't have the guy's business card, otherwise I'd tell you his name, because he'd done it.
It's the Equality MC, I believe.
Thank you.
Yeah. And I think even though that clock says it's 5 till, it's actually noon, and so give you time to get your lunch. Thank you very much for coming.
Thank you.